Do you feel exhausted, constantly feeling worn out? Do you feel the need to isolate yourself or emotionally detach yourself from work and others? Do you suffer from chronic pain and headaches or digestive problems? Do you feel unmotivated or finding it hard to concentrate? Have you lost interest in things or activities you previously enjoy? Are you someone who has the responsibility to take care of others, especially those who are sick or traumatized? If your answer is mostly yes, especially to the last question, then maybe you have compassion fatigue. Compassion, as defined by Merriam-Webster Dictionary, is a sympathetic consciousness of others' distress, together with a desire to alleviate it. Dr. Charles Figley, on his interview with Medscape, defined compassion fatigue as a state experienced by those helping people in distress. It is an extreme state of tension and preoccupation with the suffering of those being helped, to the degree that it is traumatizing for the helper. So, what does it truly mean for nurses? Why are we highly vulnerable to this? One of the studies that Dr. Figley conducted regarding compassion fatigue focused on pediatric critical care nurses. And as he mentioned on his interview, they have expected that there was a considerable turnover among the nurses, and the people who were able to make it had done the kind of self-care as ways of preventing and mitigating compassion fatigue. What they also realize is that you don't have to be a family member to get upset. You just have to be someone who really, deeply cares. Other research and studies have proven how the concept of compassion fatigue is real in the practical application to clinical nursing practice. It was even mentioned that healthcare professionals, especially those who work in critical care, those who are regularly exposed to death, trauma, high-stress environments, long work days, difficult patients, pressure from a patient's family, and conflicts with other staff members are at higher risk. Does this resonate to you? Me, it hit me right into the core. My purpose on this vlog is not to complain about the situation we are in as nurses. Or maybe in some percentage I do, let's be real here. But we as nurses know exactly why we chose this profession and why we still continue to practice in this field, despite the increasing patients' needs and demands, staff shortages, low salary, high risk to exposure to infectious diseases, and the list goes on and on. We know exactly what we feel each time we go on shift. Yes, we feel tired, but oh yes, we desire to help and provide comfort to the sick. We feel that burning desire to save lives, to make a difference in someone's life, or even simply make our patients smile despite the suffering they feel. My purpose on this video is to raise awareness about compassion fatigue, to debunk the way of thinking that you are just getting lazy as a nurse, to provide ways on how we prevent or manage compassion fatigue, and to remove that self-blame, self-criticism, and guilt each time we choose to take care of ourselves over our patients. Like I mentioned earlier, as I mindlessly scrolled YouTube videos, I stumbled upon TED Talk, where a speaker discussed compassion fatigue, and the concept hit me right into my deepest core, like an aha moment. I did not even know I was already exhibiting symptoms. I have answered yes to all of those questions I asked you at the beginning of this video. For the past 6 months, I've been feeling that something isn't right with me. Although I did not know how to name what I feel, I already acted upon it in ways I know. I think it is very relevant to talk about compassion fatigue as we fight coronavirus as frontliners. It is to better equip ourselves and be more resilient during this tough time. Today, I'm going to share with you 5 ways on how to cope with compassion fatigue. Listen to your body and acknowledge it. As the old saying goes, knowledge is power. So the first step is to learn how to pause and listen to what our body says and accept that it is okay and normal to feel that way. In my case, I've been having headaches almost every day, and they are not just simple ones. They are mostly excruciating kind of pain. So, it must be that my body is trying to tell me something, right? Maybe it is because of lack of good quality sleep, too much stress, repeatedly late lunches, and so on. And then I acknowledged what my body is telling me, so I can do something about it. Make time for self-care. I repeat, make time. I am honestly not good at this in the beginning because who has the time anyway? I remember telling myself I'd rather just sleep than get up earlier to exercise. Or I can just eat instant noodles because I'd rather be lazy than cook healthy meals. Or the classic one, I'll hold my urine for a couple more hours. I need to finish giving my rounds of medication. Or worse, I realized that I didn't feel the urge to pee for the last 8 hours because guess what? I didn't even drink water entire shift and I'm too dehydrated. So what did I do to overcome all the excuses in my head for not having time? I went back to step 1. Listen to your body and acknowledge it. I acknowledge that something is not right and something must be done to make it right. I made time. For self-care tips? Well, maybe I can create a whole separate video on that one. If you like few tips and tricks, let me know on the comment section. Establish boundaries. This one, if I must admit, I am on my baby steps. I am the kind of person who is not a fan of confrontation or calling out bad attitude or behavior towards me. I would burst into tears before I even finish my sentence. Let me share my experience. I just started working as a newly qualified nurse of United Kingdom. I was from night shift and just waiting for handing over so I could go home. Here comes our manager, walked into the unit, came into my patient's bedside, checked monitor setup, and started yelling at me about the things I should have known at the time. 7:30 in the morning, where my patients are just starting to wake up, and obviously heard all the words she told me and saw exactly how she treated me. I knew I should have talked to her afterwards and called out the disrespectful way I have been treated, but nope, I just cried and hoped it will all get better. The treatment will get better, but 3 years later, it was the same. Professional boundary is crucial. I may have not created a professional boundary at that time, but I am trying my best to learn that now. We are all in the continuum of learning process anyway. Set definitive limits. This is almost the same with establishing boundaries, except that I would like it to be smart, specific, measurable, attainable, relative, and time-bound. If you are scheduled to work for only 8 a.m. to 6 p.m., don't make it until 8 p.m. Or if you are 8 a.m. to 8 p.m., don't make it until 10 p.m. Of course, there will be instances, and definitely there will be, that we have to extend more minutes because of an emergency situation, like our patient is arresting, or you just need half an hour more and your case or operation will be finished. Of course, you cannot leave a patient on an emergency situation or leave in the middle of the operation just because your time ticked a specific number on the clock. I call these moments grace moments, where we sacrifice a little bit more of us because we are being graceful to the situation. However, it does not mean we just stop there after giving our grace. We have to make sure that the nurse in charge knows we stayed longer because the situation calls for it, and the extra time we worked should be logged in the system. Either they do time owing or they pay you for it. And my suggestion is to try to limit the situations as well. If this happens too often that you have to stay longer than your scheduled shift, you must talk to your manager in advance and inquire for the root cause. Maybe your theater list is overbooked, or maybe you are short-staffed and they keep saying there is no budget, or maybe there's overall poor care management in the unit. That's why deteriorating patients are often overlooked. Also, remember, it's not just about how much money they can pay you for your time. Time is one of the precious gifts we have in this world. You have to spend your time wisely. And last, but definitely not the least, be kinder to yourself. Most of the nurses are inherently kind to others. It is the way we are wired. So my reminder is don't forget yourself. Be kinder to yourself. You are doing an amazing job from cradle to grave. You deserve kindness too. As Johnson said, nurses provide a number of specific functions, but the essential product they deliver is themselves.